So today we will be studying about breast. This is from Vishram Singh, Volume 1. The mammary gland is a modified sweat gland present in the superficial fascia of the mammary gland is a modified sweat gland present in the superficial fascia of the pectoral region. The mammary gland is found in both sexes. However, it remains rudimentary in male but becomes well developed in female at puberty. On rare occasion, the breast of male becomes enlarged. This condition is called gynecomastia. In female, it forms a necessary sex organ of female reproductive system and provides milk to newborn baby. Anatomy of breast is of great surgical importance and therefore needs to be studied in detail. Now we will study location. The breast is located in the superficial fascia of pectoral region. Small extension from its superolateral part, that is axillary tail of spines, however, pierces the deep fascia and extends into axilla. The aperture in the deep fascia through which the axillary tail passes into axilla is called foramen of Lange. The axillary tail is the site of higher percentage. So they are basically they are telling the breast is located in superficial fascia of pectoral region. From superolateral part, axillary tail of spines passes to axilla, and the opening is called as foramen of Lange. Next, shape and extension. So this is axillary tail of breast. See, this is superior and lateral side. Next is shape and extent. It is hemispherical bulge. Extent vertically, it extends from second to sixth rib. Second to sixth rib, and horizontally it extends from lateral border of sternum to mid axillary line. Okay, second to sixth rib and lateral border of sternum to mid axillary line. Next, we'll study relations. The deep aspect of breast is related to following structures from superior to deep, superficial to deep. Pectoral fascia. The deep fascia covering the anterior aspect of pectoral major. Three muscles: pectoralis major, serratus anterior, external oblique. So muscles that are deep to the breast are pectoralis major, serratus anterior, and external oblique muscle. And pectoral fascia, it covers the anterior aspect of pectoralis major. So these are all structure relations. What? Pectoral fascia and three muscles. So which muscles? Pectoralis major, serratus anterior, external oblique. Next structure. The breast consists of following three structures: skin, stroma, parenchyma. Okay. So skin. Skin, it is the covering for the breast and present the following. It presents nipples, areola. Nipple is a conical projection below the center of the breast, below center. Usually at the level of fourth intercostal space. It contains smooth muscle fibers which can make the nipple stiff and erect or flatten it. Being richly innervated by sensory nerves, the nipple is most sensitive part of the breast to tactile stimulation, being erect during sexual arousal. Areola is the circular area of pigmented skin around the base of the nipple. It contains large number of modified sebaceous glands, particularly at its outer margin. They produce oily secretion which lubricates the nipple and areola and thus prevents them from drying and cracking. Color of the areola and nipple varies with the complexion of the woman. During pregnancy, the areola becomes darker and enlarged. Stroma. So in skin there are nipple and areola. Stroma of the breast consists of connective tissue and fat. It forms the supportive framework of the breast. The connective tissue condenses to form fibrous strands septa called suspensory ligament of Cooper. Okay, the connective tissue condenses to form suspensory ligament of Cooper. See, these are ligament of Cooper. The suspensory ligament of Cooper are arranged in radial fashion. They connect the dermis of overlying skin to the ducts. Of the breast and pectoral fascia. The ligaments of the Cooper maintain the protuberance of the breast. Their atrophy due to aging makes the breast pendulous in old age. The fat forms most of the bulk of the breast. It is distributed all over the breast except beneath the areola and nipple. Parenchyma glandular tissue of the breast secrete milk to feed newborn. Parenchyma is glandular tissue which secrete milk, consists of 15 to 20 lobes arranged in relay factions. Each lobe is divided into lobules which consist of cluster of acini. Each lobe is drained by lactiferous duct. The ducts from different lobes converge towards the nipple and open at stimuli. Near its termination, each duct expands to form into lactiferous sinus. Arterial supply. Internal thoracic artery through its perforating branches which bears second, third, fourth intercostal space. Axillary artery through its lateral thoracic, superior thoracic and acromiothoracic branches. Lateral, superior, acromiothoracic branches. Posterior intercostal artery through the lateral branches. Internal thoracic, axillary, posterior thoracic, intercostal artery. Next, venous, axillary vein, internal thoracic vein, posterior intercostal vein. See here we can see the artery, superior thoracic artery, acromiothoracic artery, lateral thoracic artery. These are the branches of axillary artery. Which artery? Superior thoracic artery, acromiothoracic, lateral thoracic artery. And these are internal thoracic artery of second, third, fourth intercostal spaces. And these are lateral branches of posterior intercostal arteries. Veins, axillary vein, veins, axillary vein, internal thoracic vein, posterior intercostal vein. Next, veins follow the artery. First, they converge toward the base of the nipple, where they form an anastomotic venous circle. From there, they run into superficial and deep set. The superficial vein drain into thoracic vein, deep vein drain into internal thoracic, axillary, posterior intercostal. Okay. Next, nerve supply. Clinical correlation. Metastasis of the breast cancer to the brain. It occurs through the following: cancer from breast cells from breast, posterior intercostal veins, venous plexus, vertebral venous plexus, intracranial, pterygovenous, and brain. Nerve supply. The nerve supply of the breast is primarily somatosensory. It is derived from second to sixth intercostal nerves through their anterior lateral cutaneous branches. These nerves provide sensory innervation to the skin and carry autonomic fibers to smooth muscles and blood vessels of the breast. The sensory nerve endings in nipple and areola play an important role in stimulating the release of milk from mammary gland in response to suckling by the infant. Lymphatic drainage. Lymph nodes draining the breast. The lymph from the breast is drained into following group: axillary, internal mammary, posterior intercostal. These are related to artery something. Next, supraclavicular lymph nodes, cephalic lymph nodes. Axillary, lying in the axilla, divided into anterior, posterior, central, lateral. Internal mammary, lying along the internal thoracic vessel. Supraclavicular, above the clavicle. Posterior intercostal, lying with posterior part of intercostal space. Cephalic, lying in deltopectoral groove. Okay, so you can see here axillary lymph node, deltopectoral lymph node, central, lateral lymph node. This is anterior, this is posterior, this is posterior intercostal, internal mammary lymph node. Like this is better representation. Next, lymphatics draining the breast. The lymphatics draining the breast are divided into superficial, deep. Superficial lymphatics drain the skin of the breast except that of nipple and areola. Deep lymphatic drain parenchyma of the breast and skin of nipple and areola. Plexus of lymph node deep to the areola is called subareolar plexus of Saphey. The subareolar plexus and most of the lymph from the breast drain into anterior group of axillary lymph node. The superficial lymphatics of the breast of one side communicate with those of opposite side. Okay, consequently, the unilateral malignancy may become bilateral. Lymphatic drainage from breast occur as well. The lymph from lateral quadrants of the breast is drained into anterior axillary or pectoral group of lateral to anterior. These lymph nodes are situated deep to lower border of pectoralis minor muscle के lower border of pectoralis minor. The lymph from the medial quadrant is drained into internal mammary lymph node. लेटरल क्वाड्रेंट का कहाँ, एंटीरियर. मीडियल क्वाड्रेंट का कहाँ, इंटरनल मेमोरी lymph node situated along the artery. Some lymphatics may go to internal memory or of the opposite side. Few lymph vessels from lower lateral quadrant of the breast follows the posterior intercostal arteries and drain into posterior costal nodes. The few lymph vessels from lower medial quadrant of the breast pierce the anterior abdominal wall and communicate with subdiaphragmic and subperitoneal lymph plexus. The lymph vessels from the deep surface of the breast pierce pectoralis major clavipectoral fascia to drain into apical group of axillary. So basically, lateral part, medial part, lower lateral part, lower medial part. Lateral part goes into anterior axillary lymph node. Medial part goes into internal mammary lymph node. Lower lateral goes into posterior intercostal lymph node. Lower medial quadrant goes into subdiaphragmatic and subperitoneal lymph node. Okay. Next, the lymph vessels from deep surface pierce pectoralis. Deep surface pierce pectoralis major clavipectoral fascia to drain into apical group. ठीक है. And next, we will study about breast cancer. Breast cancer is known as carcinoma of breast. It is one of the most common cancer in females. It arises from the epithelial cells of lactiferous ducts. In about 60% cases, it occurs the upper lateral quadrant and commonly affects females between 40 to 60 years of age. Clinically, it presents as presence of painless hard lump. Breast becomes fixed, immobile due to infiltration. Retraction of skin due to infiltration. Retraction of nipple due to infiltration. Orange appearance, purely orange appearance of skin giving rise to appearance like the skin of orange due to obstruction of superior. Painless hard lump, fixed immobile, retraction of skin, retraction of nipple, orange appearance. It is common and it happens because of epithelial cells of lactiferous duct. The knowledge of lymphatic drainage of breast is of great clinical due to high percentage of occurrence of cancer in breast and a subsequent diminution of cancer cells along the lymph vessels. Classical operation and radial mastectomy, whole of the breast is removed along with axillary and pectoralis major and minor muscles. Some lymph vessels from this place communicate with subperitoneal cancer. The cancer of breast is serious and often fatal disease. The mammography and regular self-examination help in detection. 6 steps of breast self-examination are as follows. These steps read by yourself. Thank you.